So adult nursing is a three-year course. Whether you're doing diploma or degree, it's exactly the same. There's no difference between the two. And in the first year, it's more about nursing essentials. So I don't like to call it basic stuff, but that's what it is. It's all about assessment of your patient, nutrition, observation, so your temperature, your blood pressure, getting all your foundation stuff up to standard in your first year, so it can carry you through to your second and your third. So lectures, you have main lectures that are in a big lecture theatre with all of your other adult nurses. And then you have seminars, which are lectures, but they're in a smaller group of people, and there you do more practical work. So it could be group work, could be a presentation. That's when you're usually in your tutor group, so there's a smaller number of you, about 25 of you. You've got the lecturer there, and that is your time away from the lecturer if you really don't understand anything, where you can ask your lecturer what it is, and the lecturer in that session of a seminar has got time to explain it, to make sure that you understand it before they go on to the next subject. The lectures are good, but there's lots of people there, so you're just having the lecture and then you can email then the lecturer afterwards if you've got a problem, whereas the seminar is more hands-on. And then you've got skills labs as well, so you're having practical sessions, so it's like a little pretend ward, and you go there, and that's when nurses who are still working as nurses out in real hospitals come into the university and teach you all the latest ways of how to take a pulse, how to take a temperature, how to take your blood pressure, all the latest ways and the newest ways of doing things. And they're in a little lab, and that's where that's practical sessions. So they show you, and then it's all hands-on from there. You get to know through practical. So you can do it before you go out onto the ward, and then when you go out onto the ward for your placements, that's when you just expand on there and become competent in it. The facilities, you've got an excellent library, and we got at UWE, we got one of the biggest health and social care libraries in England. So the library is great for any sort of journals or articles about recent things that are coming up in the press on nursing, and that's where you just research, because nursing is quite a lot about research, finding out what the latest literature says about doing a particular task or a certain medication. There's the IT suites, and there's computers sort of everywhere. You've got actually computer rooms, you've got the library, you've got computers in the Students' Union as well. Skills suites, like I said, you've got a whole lab, and that's where it's like it looks like a pretend ward. You've got hospital beds there, and they've got this what they call, I can't remember his name, but it's a dummy, and they can program that dummy to stop breathing, to have different types of pulse rates, so you can get a feel of everything, or try and get a feel of everything before you go out into your ward and to your placement. There's exams, but it's not all based on exams. You don't have huge finals at the end of every year. You have the odd exam halfway through your year, maybe towards the more beginning end before Christmas of your course, and you have essays as well. You've probably got about 3 essays a year, and they're all sent off to your moderator, and they mark it. But there's also a balance. It's not all about academic, like I said, it's placement as well, and that's when you get assigned a mentor, and they observe you whilst you're on placement, and you've got to pass placement to pass the year. You've got to pass both. You can't just be excellent at your academic and be total genius, and then when you go on to placement you don't know anything about the practical side of it. You still won't pass the year. Saying you've got to have that bit of academic knowledge there. You can't go to placement, be excellent with your patients, but have no idea on what you're doing or why you're doing it, and you won't pass the year. You've got to have a balance of the both, and that's how you pass your years and go through to your second and your third year and then become qualified.